Welcome to Virtual Reality Exposure Therapy for the treatment of post-traumatic stress disorder. I'm your presenter, Joy Campbell. Post-traumatic stress disorder, PTSD, affects veterans from the Vietnam era to the veterans of today's conflicts in Iraq and Afghanistan. Virtual Reality Exposure Therapy, commonly referred to as VRET, has been researched by several teams both in the United States and abroad. McLeay, Meyer-Broker, and Anderson, among others, have conducted random controlled trials which demonstrate that virtual reality exposure therapy is effective in decreasing the symptom severity of post-traumatic stress. My project is to conduct a study at the Ireland Army Community Hospital Behavioral Health Clinic for the purpose of building upon this research. The subjects will be volunteers who are currently in the post-traumatic stress treatment group. Once I have the volunteers, I, as the primary investigator, will explain the purpose of the study, the process, and the risk and benefits. The risk, which while we will try to minimize, is that their symptoms might increase. The benefit will be that their symptoms will decrease. Once informed consent is obtained, the participants will complete the clinically administered PTSD assessment, CAPS, or the PTSD Symptom Scale Self-Report. These assessments will also be completed at the end of the 10-week treatment and the 3-month and 6-month interval. Once baseline assessment is completed, each participant will receive one 60-minute session of VRET once a week for 10 weeks. The expected outcome is that their assessment scores will decrease by at least 30%, which indicate a significant improvement in their symptoms. Recruiting volunteers should be relatively easy, as VRET simulates a video game, and the scenarios will be a recreation of the soldier's traumatic experience. It is very tailored to each individual. Girardi's case study reflects how virtual reality exposure therapy affected a 29-year-old active duty service member who suffered from irritability and avoidance as part of his PTSD. After receiving 4 weeks treatments of VRET, the soldier reported he spent less time dwelling on his traumatic experience and was enjoying being around his family and spending time with them. Virtual reality exposure therapy has the evidence-based research to support being the treatment for PTSD in the military. However, more research is needed before it can become the standard of care. As advanced practice registered nurses, we have a responsibility to seek out the evidence that best supports the treatments that provide the best outcomes for our patients. Virtual reality exposure therapy does have the research to back up that it is an effective treatment for post-traumatic stress disorder in the military. Thank you.